Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. And welcome back. A Guildford area superstore in Surrey, BC has had an employee test positive for COVID-19. And, of course, they're asking for anyone who may have been working at the time when this person was last at that superstore to self-isolate and let health authorities know, of course, who you are. There's also been a fruit packing plant in Abbotsford that has had a person test positive, and also a possible outbreak in a long-term care home also in British Columbia. Along with that, we have Dr. Bonnie Henry, who is making statements about current outbreak situations. And so let's listen to what she has to say in her latest press conference from July 27th.
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is British Columbia's COVID-19 briefing for Monday, July the 27th. Honored to be here on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, Tuesday, we'll be providing a written briefing at around 3 o'clock. And with that, I'm honored to introduce Dr. Bonnie Henry.
Thank you and good afternoon. Today we're reporting, as we do over the weekend, on 3 periods. From Friday to Saturday, we had 36 new cases of COVID-19. Between Saturday and Sunday, there were 21 new cases, and Sunday to today, an additional 24 cases. That's a total of 81 new cases who either tested positive, and 7 of whom were epidemiologically linked cases, bringing our total in British Columbia to 3,500 cases. That includes 1,064 people in the Vancouver Coastal Health Region, 1,800 people in the Fraser Health Region, 143 people in Vancouver Island Health, 353 people in the Interior Health Region, 80 people in Northern Health, and 60 people who reside outside of Canada. We have now 264 active cases in British Columbia, of whom 11 people are in hospital, 3 of whom are in critical care or ICU. Unfortunately, we've had 2 additional deaths here in British Columbia, both of whom were residents in long-term care in Vancouver Coastal, bringing our total to 193 people who've died from COVID-19. And our condolences go to the families and the care teams and the communities of these people who have died most recently. We have 3,043 people who are now fully recovered from COVID-19. We have no new healthcare outbreaks. 3 remain active, 1 in long-term care and 2 in acute care. We now have 664 cases in our healthcare outbreaks, an increase of 2 in the staff category. 260 staff, healthcare workers, and 404 residents have been affected. We do have 1 new community outbreak in the Fraser Health Region at the Fraser Valley Packing. It's a blueberry packing plant in the Abbotsford area, and there are now 15 cases associated with that plant as the investigation started on late Thursday and over the weekend. And Fraser Health is working with the plant, doing ongoing testing of the residents and the workers at the plant, and doing an investigation to ensure that all of the safety precautions that need to be are in place. We now have 14 confirmed cases associated with the outbreak that was declared on Friday in the Haida Gwaii area. And As you know, health authorities and the BC CDC are also now posting all of the community exposure events that we've had, including flights and other locations where the public may have potentially been exposed when we can't identify everybody who might be at risk. We now have over 1,010 people who are required to self-isolate in BC because they have been identified as being exposed to COVID-19 and are at a high risk at the moment. And a reminder to people who have been identified as close contacts of cases. And if you have been told to self-isolate, this is not optional. This is a requirement. This is what you need to do now for the duration of the incubation period from when you were exposed to ensure that if you develop symptoms, you're not going to pass it on to others, particularly those that you're closest to. I understand this is difficult, especially now in the summer, where it means you cannot work. It means you have to stay away from your family and friends and not leave your home unless it's important to get medical care. Nobody wants this, and this is why it is so important that we continue to take our actions now to protect ourselves and protect each other as we move through our pandemic. We can all enjoy our summer, and we know what we need to do, and to ensure that our COVID-19 curve bends down again. Let's continue to take those necessary precautions to reduce the potential for this virus to spread in our communities, among our friends and our family. Start planning today for what you're going to be doing to make your BC Day long weekend a safe weekend. And as I've been saying from the very beginning, go play outside, but play safe. Take this time to assess the risk before you're spending time with others, particularly people that are not in your close contacts, in your bubbles. Put measures in place to protect yourself and those that you care about. How will you give people the space to stay safe? Are you spending a short time together, or are you spending a longer time together? Are the people that you're going to spend this time with in your bubble, or do they have other contacts that might expose you? If you can't say yes to all of these questions about the risk, then say no to that activity and choose something else to do instead. Spending time outside is far safer, we know, than being indoors. So take advantage of that here in British Columbia in the coming weeks. Avoiding closed spaces, avoiding crowds, avoiding that close contact with people in any environment, inside or outside, are the things that are important for us to remember now. Ensuring you have safe physical distance is important, no matter where you may be. I will say again that this is not forever, but it is for now, and we know we can do this. We know that this is what will get us through the next months until we have an effective treatment or a vaccine. As you know, we've been focusing on taking actions in areas where we know there has been transmission and where transmission continues to occur. And last week we modified our orders around restaurants and pubs and food and nightclubs and establishments like those. Today I've amended the order on mass gatherings to limit the number of people in short-term rentals and vacation accommodations. So that includes places like houses that are being rented out, boat rentals, cabins, yurts, as well as hotel rooms. The number of people is limited to the capacity of the space, plus up to a maximum of 5 visitors. That means you cannot have a large group of people over to party in your hotel room or on your boat during this period of our COVID summer. It's the responsibility of the owner of the property to ensure that the order is adhered to and to ensure contact tracing information is collected for everyone, guests and visitors alike. This means that should somebody in your party have COVID-19, we are able to contact you all quickly and efficiently to prevent ongoing spread in our communities. We've also added some clarity about what an event is to the mass gathering order and to ensure that people know where it doesn't apply. And that includes, of course, workplaces, schools, secondary, post-secondary educational facilities, places like these. However, we have reinforced again the need to maintain the number of people that can be at a mass gathering with physical distancing and other measures in place at 50. and it will continue to stay at 50. When traveling as well here in BC, whether you're traveling or whether you're coming to BC from other places in Canada, we need you to travel safely, to use your travel manners. Be courteous and considerate of those around us. Don't ask a venue or their staff to bend the rules. Thank them for their efforts they're making to keep all of us safe. That means that we cannot put tables together. We cannot gather in larger groups at restaurants or pubs or events. Those are the things that put the people who are working there at risk. Here in BC, we show the way to people. We bend the curve, not the rules. Let's use these summer days to bend our curve back down and protect everybody here in BC. And let's also remember to be kind, to be calm, and to be safe.
Thank you very much, Dr. Henry, and on behalf of the Premier and the government, I think people in BC I want to pass on right away our condolences to the families, the friends, the community, the people who are helping with care of the two people who passed away, one from Friday to Saturday and one from Saturday to Sunday in the Vancouver Coastal Health Authority in long-term care. We know what a difficult time it's been in long-term care. We reflect on that every single day, and we know how difficult it must be for the families who are dealing with the grief of the death of a loved one in this time. We want everyone to know that we understand and to the extent that we can share their grief, and we want to send them all our very best in this difficult time. Wanted to say that, of course, 81 cases over 3 days is something we take seriously. Really, any number of cases, any number of active cases in the community are cases we take very seriously. In particular, we have a new outbreak today in the Fraser Health Authority, which is, as always, is a cause for concern. And just as it has been in other cases, it's the work of public health to both on-site and through contact tracing break as much as possible those chains of transmission. And when there is an outbreak, it shows why those resources and the precautions that we are taking and asking everyone to take are so important. Wanted to note that there are 11 people in acute care hospital today across BC. That's -1 from where it was Friday. So that's 11 across BC. That's 5 in Fraser Health, 2 in Interior Health, and 4 in the Vancouver Coastal Health Authority. We're again at a fairly consistent level in terms of emergency room visits. Yesterday, Sunday, we had 5,737 emergency room visits. I also wanted to acknowledge all of those who have become either re-registered or become emergency registrants in our healthcare system. We want to thank them again. They include 1,516 new healthcare assistants or care aides, 207 temporary healthcare assistants, 441 registered nurses, 5 registered psychiatric nurses, 79 licensed practical nurses, 2 nurse practitioners, 64 allied health workers, and 74 doctors. And we express our appreciation to all of those people for the work they're doing in helping all of us deal with not just COVID-19, but all the health emergency with respect to the overdose crisis and all of the other challenges in our healthcare system. That's a big thank you to all of them and all our healthcare workers. I want to provide my weekly update on PPE today. As with previous weeks, I report on how much PPE has arrived cumulatively and then specifically what has arrived in the last week. If you'll recall from last week's report, Monday, July 20th, so far just over 6 million N95 or equivalent respirators come to BC, almost 26 million surgical or procedure masks, 2,310,000 pieces of eye protection, 63 million pairs of gloves, and just over 3,500,000 gowns. Today I can tell you that over the last week, since the update on Monday, July 20th, up until yesterday, we've received 11,528 N95 or equivalent respirators, 3,237,950 surgical or procedure masks, 86,689 pieces of eye protection, 2,788,750 pairs of gloves, and 1,197,108 gowns. We'll continue to source and test our PPE and are working hard to pursue any and all credible leads for safe and effective product for our health system. And I continue to thank all of those working on that project for all they've contributed in the last few months. In closing, I just want to say that COVID-19, I think, has drawn on our greatest strengths as British Columbians, our generosity, our empathy, our understanding, our compassion, and our kindness. We pulled together and we made sacrifices, and for many of us, the sacrifices have been heartbreaking. We know the job that must be done to keep us safe. Where we stand today is due to our individual and collective efforts to stop the spread. We made a difference because each of us is the difference. And it is this difference, the discipline, that saw us bend, then flatten our BC curve. Another great example of our assets, I think, as British Columbians, all of us, is our humility. When we make mistakes, we learn, we adapt our behavior, and in doing so, inspire each other to do better. The past weeks have shown what can happen in some places, on some occasions, when we let our guard down. They've shown us how COVID-19 bursts our bubble when we fail to stay within it. They've shown us that we must recommit to using our COVID sense. This means physical distancing saves lives. Wearing a mask is the right thing to do when we can't maintain physical distance. Keeping our number of contacts small, knowing the upside in being outside, washing our hands often and for 20 seconds with soap and water. Listening and being respectful to people who are asking us to take actions in their store or restaurant that will keep us healthy and stop the spread. And we want to really emphasize that today. And of course, staying home always. Not going to school, not going to work, not going out if we're sick. We must continue to do what is proven works for us. We must use our COVID sense to keep us safe and stop the spread. Using our COVID sense will drive our numbers of new cases into decline. It will prove once again that we bend the curve, not the rules, and when we do that, we make all the difference. As we approach our BC Day long weekend, let's acknowledge this is our first BC Day celebration in our new BC normal. Our BC plans for the coming long weekend must ensure that we play safe, that we stand apart, and that we stay 100% all in our commitment to renew the fight to stop the spread. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune, soit celle des 24 et 25 juillet, celle des 25 et 26 juillet et celle du 26 juillet jusqu'au 27 juillet en mi-journée. Nous sommes attristés d'annoncer 2 nouveaux décès liés au COVID-19 dans le région de santé de Vancouver Coastal, pour un total de 193 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches pendant cette pandémie. Pour la première période de référence qui s'étend jusqu'au 25 juillet, nous avons eu 36 nouveaux cas. Pour la deuxième période de référence qui s'étend jusqu'au 26 juillet, nous avons eu 21 nouveaux cas. Au cours des dernières 24 heures, 24 nouveaux cas se sont ajoutés. Cela représente 81 nouveaux cas depuis vendredi pour un total de 3500 cas en Colombie-Britannique. Il y a, parmi l'ensemble des cas confirmés de COVID-19, 11 personnes sont actuellement hospitalisées, dont 3 en soins intensifs. Thank you very much. Merci beaucoup. We're happy to take your questions.
Thank you, Minister. As a reminder to everyone on the phone, please press *1 to enter the queue. You are limited to 1 question and 1 follow-up only. Please also take your phones off mute. You will not be audible until I call your name. First question is from Richard Zisman, Global News.
Dr. Henry, we're seeing increased cases of people with U.S. license plates here in British Columbia being harassed when they go to the grocery store or elsewhere. I know you've been asked about this before, but I just was wondering what sort of advice you have for those who are harassing, and do you have any advice for those who are being harassed? And do you agree with Premier Horgan's assertion earlier today that those people should change their license plate to BC license plates, or take a bike or take the bus?
Well, I'll start by saying that, I always encourage people to take active transit or transport, so that biking, running, those are all things that are good for us in many ways. But when it comes to people, I have said many times, and I know this to be a fact, there are many reasons why people have different license plates here in British Columbia. Many people returned, many Canadians, British Columbians returned from living in the United States, whether they had been there for a short time or a long period of time. And who would blame them, considering what's happening now? Many people came home to look after elderly family members, and we need to respect that. We also need to respect that many people have been here for a long time. They may have done their isolation, and they are members of our community, and we need to treat everybody with kindness and with respect. We do not know everybody's story, and I think we need to pay attention to the fact that we all are in this together. Whether our license plate is from somewhere else, whether it's from Alberta, whether it's from California, or whether it's from here. We are here now, and we all need to do the things to keep each other safe here now.
Do you have a follow-up, Richard?
I do. Dr. Henry, I'm hearing from a lot of parents as we head towards, the weather is warming up and we're heading towards the long weekend, and even thinking about school, and they're trying to plan gatherings with other families. Can you speak to the specifics around children playing with other children if the parents are distant, like at a water park or a beach or in a backyard? Or are there safe ways to do this in terms of young, and as there are different ages that are safer than others?
Yeah, so we do know that younger children under the age of 10 in particular seem to be less likely to be infected, less likely to pass it on to others. But the basics really still the same. Smaller numbers. Keep the groups of kids together as small as possible. And yes, we need parents to maintain our safe distances. We do know that young kids as well, it's challenging for them to understand what a meter is or 2 meters. And the focus really should be on avoiding physical contact with the children who are outside your immediate family and your immediate bubble. So those are the things that parents need to consider. And of course, the really important thing, get outside. It's perfectly safe to play outside, and it's better for us all. But washing our hands carefully before we go out, and then after we've been playing, particularly before we have meals and things like that. Those are the important things that will keep us safe. We also know that this virus is not spread through water, particularly in pools when it's been chlorinated, and it's very sensitive as well. It's killed quite easily by ultraviolet light, so when we're outside, that's better. So those are the really important things. Keep the numbers small. Try and avoid touching each other, physical contact with the children who are outside your close, immediate household or your bubble that you've had agreements to stay together on. And those are the things that are most important right now.
Next question is from Zara Premji, CBC.
Hi, Dr. Henry. So this week we expect to hear about the reopening of schools. Now, the Premier asked parents to have a plan B ready just in case. So what can you tell parents about what you would like to see schools have in place in order for them to open safely in September?
Yeah, well, we've been spending a lot of time on this with a large number of people, and we'll have much more details coming later this week. But I will say that we all need to, there are many unknowns around this virus, and we have seen that. We've seen what's happened all around us, and we know that we can't be complacent. So it is important for families to be flexible, and for workplaces to think about being flexible as well as we come into the fall. I will say we have done a lot of looking at what are the unintended negative consequences of children not being in classroom learning situations. And we know there's tremendous impacts on emotional health, on mental health, on other factors around children's ability to socialize and to learn. And that's why it is so important, and we're putting so much effort into making sure we can do this in a way that supports all children and their learning needs in the fall. And those vary by age of children as well. So these are things we all need to think about. We'll have some more details about what we're planning in the system coming up, as you say, later this week. But I think we all need to understand that we've not been through this before. We've not, at least most of us have not. There are a few people who are over 100 who have been through something very similar, but they probably don't remember it. So we need to learn together, and we need to plan for all contingencies. As we've said many times, when this virus is anywhere, we're at risk everywhere. So we need to pay attention to what's happening around us as well. But I do think that there is absolutely ways that we can get almost all, hopefully all, children back into an in-class learning situation in the fall, and we're going to be planning towards that.
Do you have a follow-up, Sarah?
Yes, definitely. So would you consider making masks mandatory then for children and teachers? And if not, why not? And if you don't mind doing that in French as well.
So, I've said this many times as well. Masks are an additional layer in certain situations, and I don't see making masks mandatory in school settings being a reasonable approach right now, at least from the evidence that I have seen. I do think there are some situations where masks would be helpful, particularly on transit back and forth to school, in some of those situations where you may be in close contact, not able to keep the physical distancing, so in transitions, perhaps in hallways. I also think we need to remember that much of the transmission that we see in workplaces and school settings is between the adults in those settings. So there might be a role for masks in areas where adults are together, where they, I'm thinking of break rooms and things, where they may not be able to maintain their physical distancing as well. But at this point, there's no intention to make it mandatory, and certainly not in the in-classroom situations for young children.
Merci beaucoup. C'est pas notre intention pour le moment de mettre en place une loi obligatoire pour les masques. On comprend l'utilité des masques. Moi-même, j'utilise des masques souvent quand je vais à l'épicerie, par exemple, mais ce n'est pas à notre sens utile, et cela ne suit pas l'évidence d'avoir une loi obligatoire, c'est-à-dire un mandat obligatoire pour les masques. Il se peut que ce soit utile, par exemple, pour les adultes, dans un contexte éducatif, de porter des masques, et on va sûrement considérer cela, mais en général, il n'y a pas nous sommes convaincus que la bonne voie, le bon chemin, c'est de faire des recommandations fondées sur la science, et dans ce contexte, c'est pas, à notre sens, la bonne voie maintenant d'avoir une loi obligatoire, c'est-à-dire un mandat obligatoire pour les masques.
Next question is from Lisa Houston, News 1130.
First one for you, Minister Dix, just regarding American plates and people being harassed. In the Yukon, they brought in a program where people have stickers to show that they get through the process, and they are a thumbs up from the province or the territory there. Any consideration to moving to something like that here, considering we're going to be in this situation for some time?
Sorry, I don't think I quite understood fully the question.
In the Yukon, they brought in a process, or people get stickers on the cars. If they have foreign plates, they get a sticker on the car that says, they're okay to be here. Is there any consideration to doing something like that in British Columbia for people with foreign plates?
Well, we don't reject any suggestions at hand, and I'm sure we'll take a look at that, maybe talk to our friends in the Yukon. Let me say this about it. It's everybody's obligation to behave well. I heard a question earlier, it talked about people harassing. Well, it's never okay to harass. And it's the obligation of Canadian Border Services to ensure that our laws are upheld, and they are working very hard to do that. Our public servants worked hard to ensure that the quarantine of Canadians returning to Canada and others, including temporary foreign workers, were upheld. And this is true, by the way, of people visiting British Columbia, whether it's from other provinces or through whatever circumstances they come here. That when people come here, they, of course, are guests, but that means treating everybody well. Means treating not just doctors and nurses and health sciences professionals well, but treating people who work in liquor stores well, and waiters well, and people who are serving in any service industry well, or people who are working in hotels or resorts or any other facility. In other words, we have an obligation to one another that's especially true in these times to be kind. And being kind is an effective way, we found in British Columbia, of fighting the virus. So the obligation is not just on those here to, of course, understand that it will be other people who have the legal foundation to enforce the law and to try and be fair to everybody, but also the obligation on people who might be visiting British Columbia from other places in Canada to treat the people that they meet here like they were their own family and their own friends in their own neighborhood.
Do you have a follow-up question, Lisa?
Yes, this one's for Dr. Henry. When you're talking about children, Dr. Henry, you mentioned that kids, are less likely to transmit if they're and catch the virus if they're under 10, but that they still should remain in their bubble, only having close contact with those in their bubble. How is this going to be possible when kids return to school, or should we consider that any child in our children's class are now part of our bubble?
Yeah, absolutely. And that's one of the things that we're looking at. How do we create those cohorts where you have the contacts, but you minimize contacts with others in the school? So those are the options that we're looking at, because that's really the only practical way to do it. And it needs to be done differently for different age groups of children. So more details about that will come out. But absolutely, we've looked at that in people having work cohorts. We're having small numbers that you stay with on an ongoing basis that we know we can connect with. We know who it is that you spend your time with. And so if a case arises, we can effectively care for people and isolate people if need be.
Next question is from Carissa Gall, Haida Gwaii Observer.
Hi, Dr. Henry. Regarding the 14th confirmed case of COVID-19 on Haida Gwaii, is that case also a local resident believed to be linked to the 13 cases announced on Friday? And are they self-isolating at home or in hospital?
Currently, everybody is self-isolating at home. They're being monitored daily by Northern Health and by the community. And yes, it is another community member, and we believe, though they're still putting all of the pieces together, but yes, we believe it's linked to the cases that already in the community in Haida Gwaii.
Do you have a follow-up, Carissa?
No, thank you.
Thank you. Next question is from Gordon Hoekstra, Vancouver Sun.
Oh, good afternoon. Thank you for taking my question. A couple questions around testing. Dr. Henry, with the uptick in infections, and I think there's, at least from a public point of view, maybe perhaps some delay in testing in Interior Health, Vancouver Health, even in Lower Mainland here, people have to wait in line a bit. I think BC's capacity is about 300, 3,500 a day, although it doesn't always do that. Is there a need for expanded testing?
So our capacity is about 8,000 tests a day now, and we are expanding that capacity. But yes, there has been some challenges, particularly in the interior, with large numbers of people who were exposed at a number of different events, and there was some equipment challenges over the past 2 weekends as well. So that is being sorted out, and actually we are looking at enhancing, and over this weekend they were able to really drive up the testing of people who were at risk. I'm not aware of any delays in testing in the Lower Mainland. That's mostly been working fairly well. Our average turnaround time is 22 hours. That is a little bit longer in some areas compared to others, but it is something we're watching very carefully. But we have said, and we are planning to ramp up to at least double what we are able to do now as we move into the fall, because we know there will be other respiratory viruses that could potentially be causing illness as well. So rapid testing will be really important.
Do you have a follow-up, Gordon?
I will say as well that one of the things that is really important, if you are somebody who's been exposed and you have any symptoms and you're being tested, you must isolate until you get your test results back. And I know that's frustrating, especially if in some cases it may take 2 to 3 days, but it is very important that you do stay away from others during that period of time, because that's when you're most infectious to others if you are testing positive.
Do you have a follow-up, Gordon?
I do. Just wondering, BC appears to have taken maybe a slightly different approach in some jurisdictions, including within Canada, on testing. BC's testing rate is low compared to many jurisdictions in the world, including within the province. I'm just wondering, I mean, I think initially you heard the WHO general directors talk about, sort of the message was test, test, test. I'm just wondering if you can comment on BC's approach to testing and sort of explain what the thinking has been.
As I've said many, many times, yes, we started very early on with widespread testing to understand where this virus was coming in our community. Once we had community spread, we focused on ensuring we could test those people who we knew might have an impact on our healthcare system. So we focused our testing, and during that period of time, our test positive rate went up. So we were testing the right people at the right time. As our illness in the community decreased and we got control of the pandemic, as our curve was flattened, we went to more widespread testing again. So now there's widespread testing across the province. There's access across the province for anyone with any symptoms. And we also do testing for people who are asymptomatic in specific situations. For example, workplaces, long-term care homes. With long-term care home, we test all of the residents, all of the staff, whether they have symptoms or not. We know some of these high-risk exposures. For example, in some of the nightclubs, whether people have symptoms, if they've been identified as being a close contact, we test them regardless of symptoms. So the important thing is that we're testing the right people at the right time and able to make sure that we have access to testing available for people. It has been shown around the world that doing testing of asymptomatic people who have very low risk means that you get way more false positives than anybody who truly has the disease, and that creates a burden on our system and unnecessarily uses resources. So we aren't doing that in a broad way here in BC. We're focusing our attention on where testing can make the most difference for the individual, but also for us as a community. And quite frankly, one of the reasons our testing rates have come down is because the transmission and the people who are ill with COVID have come down in our province. So there's no need to test people if there's no risk or chance that they might be positive for this illness. So that's something that we're focusing on. We're focusing on making sure we have the tests that are available for the people that need it and that we can do broad testing when it's needed.
Next question is from Shannon Patterson, CTV.
Oh, hi, Dr. Henry. Back to the schools announcement that's coming later this week. I don't know if you saw on the weekend, Terry Mooring, the president of the BCTS, tweeted sort of where her membership is at. And she said about half of them were concerned about going back in June, and about a third of them are still really concerned and have medical concerns about going back in September. So my question to you is, do teachers have a right to be worried and concerned for their health if they end up back in the classroom full-time in September?
I think all of us are worried. All of us don't know what's going to happen. We all have anxieties, and this is why we all need to learn as we go. We're making adjustments as we go. We learned quite a lot about what works and what doesn't work in June, and that's put us in good stead for making sure we have plans for the future that are the safest for all involved, including teachers. And absolutely, we all have some anxieties about going back full-time, but I think we need to address those. We need to work together on making sure that we have things in place. And, we've not done COVID before, but we've had outbreaks in our school systems before. We know how to handle those, whether it's measles, whether it's influenza, chicken pox, pertussis, meningitis. There are many things that happen in our congregate settings, particularly in school settings, and we can manage those together. And we need to do that through this pandemic. We know that there are many downside impacts on children in particular, but when they aren't in a school setting, and those can last a lifetime. So we have to balance our risks and make sure that we're as prepared as we can be and as safe as we can be for everybody. But, this is a new thing. None of us signed up for having a pandemic, and we all need to adapt and make sure we have everything in place to adjust and to support our school communities, our learners, as well as our educators as we're going into the fall. And that's what we're going to be doing.
Do you have a follow-up, Shannon?
Yeah, the cases in Haida Gwaii, it is such a small community. How concerning is an outbreak of this size in a community that small, and what's being done to make sure that people have access to the resources they need there?
Yeah, we have been concerned, of course, from the very beginning about the potential impact on many of our remote communities. Many of them are First Nations communities, and the Haida First Nation has been very active on supporting their community members across Haida Gwaii to protect them as much as we can. The other part that we've been working on is making sure we have contingency plans for if and when it is introduced into the community. So one of the key things about declaring the outbreak last week was making sure that that allowed us to pull the community together so that we could ensure that there was the health resources that were available as they are needed, and that people who were being asked to self-isolate either because they were sick or because they were exposed got all of the supports they needed in their community. And so those meetings are ongoing, but the community has come together, and we're working together to make sure that everybody gets what they need and that we can get through this together.
Next question is from Arthur Williams, Prince George citizen.
Hi, Dr. Henry. Sorry, my apologies. If I do the math right, we've got looking at 3 new cases in Northern Health. You mentioned one of them is linked to the Haida Gwaii outbreak. Are the other 2 new cases linked to any known outbreak? I'm thinking particularly the worker in Site C who tested positive.
There's no additional cases at Site C that I'm aware of. There has been sporadic cases in other communities in Northern Health over the last couple of weeks, but there's just the one that's related to Haida Gwaii.
Do you have a follow-up, Arthur?
No, that's good. Thank you.
Thank you. Dr. Henry, if I could ask you to please repeat your updated orders from your opening, the feed cut out. So I would like to get to that before the end.
The things that I've amended. All right. So I will go back to that. As you know, we've been focusing on taking actions in areas where we know there has been transmission. And so last week we revised the orders around the pubs and restaurants and events that happen in food premises like those to ensure that we had more controls in place that prevented people from gathering and mixing and putting both staff and other patrons at risk. And today we've amended the order on mass gatherings to limit the number of people in short-term vacation rentals, including whether they're house rentals, boat rentals, cabins, yurts, hotel rooms. And the number of people is limited to the capacity of the space, plus up to a maximum of 5 visitors. So this is to get at what we were seeing happening in various places around the province where there were people having parties in their rental suites or their houses or on boats where there was groups of people. And we know that that was an area where this virus has been transmitted. It is the responsibility of the owner of the property to ensure that the order is adhered to, and additionally we need to ensure that contact tracing information is collected for everyone, guests and visitors alike, in those settings. We've also clarified in the order about what an event is and define that a little broader so that people understand it. We were getting a lot of questions about that and about what the maximum number of 50 in terms of an event applies to. And we've reinforced again that it does not apply to workplaces, work sites, schools, universities, for example. So those are the key things around the amendments of the orders, to include vacation accommodations and some of the restrictions to reduce the numbers of people in those settings.
Thank you. We have time for one more question this afternoon. For any reporters that didn't get to ask a question today, there will be a statement released later this afternoon. For recommendations on protecting families and communities and for access to provincial guidance on COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. Last question is from Keith Baldry, Global News.
Hi, Dr. Henry. Thanks for taking my question. How concerned are you about what we're seeing in Alberta right now, where on the weekend we had 81 cases, they had 304, there's close to 90 people in hospital there, 17 in ICU. Their numbers continue to spike upwards at a much higher degree than here in BC. And this is not a license plate question, but we do get 6 flights a day from Edmonton and Calgary landing at YVR. Are you concerned over the summer that we're going to be seeing the importation of COVID-19 from Alberta in large numbers?
Yeah, obviously I'm concerned about what's happening all around us. Alberta, absolutely. We know there's a lot of families who are connected across Alberta. We know that many parts of BC are much closer to Alberta than they are to healthcare services in the Lower Mainland, for example. What we need to focus on is ensuring that when we're here, we're doing the things that keep us all safe here. And if people are here from Alberta, whether they live here or whether they're visiting from Alberta, then we need to ensure that they are part of our team in doing the right things here as well. We have had people introduce the virus here from Alberta, and that is a possibility. I know my colleagues in Alberta are working very hard to make sure that they are controlling their outbreak as well and their pandemic, and it's taken a different trajectory than ours. We need to continue to do the things that we're doing, and we invite Albertans to, when they are here, to make sure that they're doing the things we need them to do as well.
Do you have a follow-up, Keith?
Yes, and this may be covered by the fact you've amended your order. We had reports over the weekend in Osoyoos of, again, mass parties at resorts. Does this now mean that these facilities themselves will have to sort of step up and police their own common rooms and visitations by guests?
Absolutely, and so the onus is on the owner of the property to ensure that this is in place. I will say as well that in the Okanagan, in the Lower Mainland, and other parts in British Columbia, we have been stepping up compliance checks on restaurants and bars and settings like this, and with the order in place, that will facilitate that as well. I also understand that in places like Third Beach or Second Beach, there's some very stern posters of me that have been put up to dissuade people from congregating in large groups, so maybe that'll be effective too.
That's all the time we have for today. Thank you.
Thank you.
So, British Columbia health officials are trying to get a handle on the outbreak situations that are going on right now, as you just heard, and they're trying to get people the message across, hey, we need to continue with the social distancing, we need to continue with all the things that we have done that have kept the number of cases down in British Columbia. So you've heard what Dr. Bonnie Henry's had to say about that, and we've over time heard, of course, statements from Adrian Dix and Premier John Horgan about what we need to do, and we can do better than what we're doing in order to keep those things down. So please click the subscribe button wherever you see it on your screen so you can get continued updates from us. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.